OHSU is an academic medical center. Because it is the leading provider of complex cases at Oregon, we see all types of cases. We don't just see ordinary degenerative cases, but we also see heavy load of trauma, infection, and oncologic cases, which you don't always find in other centers.
I'm David Faraci. I'm a former fellow here, spine fellow, and now I practice in Baton Rouge, Louisiana. The big point for me is they're doing big surgery here, so I knew when I got out I'd be comfortable with anything I wanted to do.
One of the strengths of the program is the breadth of the cases that you're going to see. Our goal is for you to do every kind of spine case, from cervical, thoracic, and lumbar, to bread and butter degenerative conditions, to complex deformity and tumor cases. Essentially, you'll see the whole spectrum from minimally invasive to traditional open techniques.
It's our expectation that by the end of their fellowship year, a graduating fellow should be able to have the independence of thinking and then surgical skills to take a patient all the way from the meeting them in clinic through surgical planning and through the procedure with complete autonomy. This is true for cases that are more bread and butter, including simple primary decompression procedures, all the way through much more complex deformity, trauma, tumor, and adult reconstruction cases.
You know, I thought I'd know a good bit coming into this fellowship, but you know, I quickly realized, you know, there's a big learning curve to it, especially when you get on your own, and they give you enough autonomy here to where you kind of know your limitations, but by the end of the fellowship year, you really feel comfortable with everything, which is nice.
It's a very busy clinical fellowship. The fellows will rotate with each of the attendings here and gain exposure to different styles of operating. Over the course of the year, you will learn and refine techniques in minimally invasive surgery, navigation, open surgery, as well as essentially instrumentation anywhere in the spine. Hopefully you'll pick and choose from different techniques that you like and combine them in a synergistic way into your own style and take that out into your own practice.
I think I did around 400 cases, which is a lot for a spine fellow. And it ranged from microdiscectomies to minimally invasive to adult deformity cases. So it's a really wide variety.
So we would like our spine fellows to become a very proficient surgeons. I believe that is the primary responsibility of a fellowship. But those who have a strong interest in research, especially clinical research, we also have a very robust research program. You might think it stands on its own, but actually most of the training program is based on the legacy. And some of the legacy that I think people should remember is how the surgeons here have been trained. We have been trained by some of the best surgeons in the world, such as Dr. Borman, who has passed away several years ago. I was his partner as well as his trainee for many years. And I try to carry the principles that was taught to me by some of the greatest leaders in spine surgery. And what I'm trying to impart to my fellows is the continuation of that tradition and understanding of the spine that they will carry with them for the rest of their life.
I'm proud of our fellowship and the fellows that we've trained here. I think the vast majority of them have gone on to contribute in a substantial way to both the medical community as a whole, as well as in their local communities. And I think they're all doing wonderful things for their patients as well. We're looking for motivated candidates that are looking to have a spine-focused practice. Our candidates come from all over the country, from all different backgrounds, and have a wide range of career goals ranging from academics to private practice, small communities and large. Practice focuses from simple community-based spine to complex deformity and reconstruction practices.
I would like someone who wants to take care of their patients. What that really means, they have to become not only an expert in that field, but somebody who is going to continually learn, because the field is changing constantly, as well as they have to have that patient's welfare always in their mind. It's that drive toward caring for patients that keeps us always be informed and always striving to be better. And that's the person I am looking for.